In the winter of 1901, a young woman named Eleanor Ashford stood at the iron gates of Westbrook Asylum for the Insane, clutching a carpetbag and wondering if she'd made the worst mistake of her life. The institution loomed before her, a massive brick structure with narrow windows that looked more like slits in a fortress than openings meant to let in light. Snow fell in heavy flakes, muffling sound and turning the world into something silent and strange. Eleanor was 23 years old, educated at a women's college in Massachusetts, and desperate for employment that would allow her to use the nursing training she'd worked so hard to acquire. When the advertisement appeared in the Boston Globe seeking nurses for a private asylum in upstate New York, she'd responded immediately, despite warnings from her instructors that asylum work was grueling, depressing, and often dangerous. The position offered room, board, and $30 a month, more than she could earn anywhere else as a single woman, with no family connections and no inheritance. The superintendent who'd hired her through correspondence was a Dr. Nathaniel Brennan, described in medical journals as a pioneer in the treatment of mental illness. A man whose radical ideas about curing insanity had attracted both admiration and controversy in equal measure. Eleanor had read some of his published papers during her training. His theories were unconventional. He believed that madness was not an incurable moral failing, but rather a disease of the brain that could be treated through careful intervention. While other alienists relied on restraints, isolation, and moral instruction, Brennan advocated for what he called active treatment, direct manipulation of the nervous system through methods he'd developed himself, but never fully described in his published work. Eleanor found his ideas fascinating, even inspiring. The notion that the insane could be cured rather than simply contained seemed both humane and scientifically progressive. She'd imagined herself as part of a noble endeavor, helping to pioneer new treatments that would revolutionize psychiatric care. Standing at the gates now, looking up at the forbidding structure before her, she felt her enthusiasm waver. The asylum looked like a prison, and the silence was oppressive despite the presence of several hundred inmates supposedly housed within those walls. She took a deep breath, squared her shoulders, and pulled the bell cord beside the gate. After a long moment, a man appeared, an orderly in a stained white coat, his face expressionless. He unlocked the gate, took her bag without speaking, and gestured for her to follow him up the long driveway toward the main entrance. The grounds were extensive but barren, with no attempt at landscaping beyond a few bare trees that stood like sentinels in the snow. No patients were visible outside, which Eleanor supposed made sense given the weather, though she'd expected to see some evidence of the therapeutic outdoor activities that Brennan's papers mentioned. The interior of the asylum was dimmer than the overcast daylight outside. Gas lamps burned in sconces along the corridors, casting yellow light that seemed to emphasize shadows rather than dispel them. The air smelled of carbolic acid, boiled cabbage, and something else, something organic and unpleasant that Eleanor couldn't quite identify. The orderly led her through a maze of hallways, past closed doors behind which she could hear occasional sounds, moaning, crying, laughter that didn't sound quite sane. He finally stopped at an office door, knocked once and entered without waiting for a response. Dr. Nathaniel Brennan sat behind a massive oak desk, covered with papers, medical instruments, and anatomical drawings. He was younger than Eleanor had expected, perhaps 40 years old, with dark hair graying at the temples and intense blue eyes that fixed on her with unsettling focus. He was handsome in a severe way, with sharp features and a lean build that suggested either asceticism or simply forgetting to eat regularly. He stood as she entered, came around the desk, and shook her hand with a grip that was firm, but not overly familiar. His voice when he spoke was cultured, with the accent of someone educated in the Northeast, possibly at Harvard or Yale. He welcomed her to Westbrook, expressed pleasure that she'd arrived safely despite the weather, and immediately launched into a description of the asylum's mission and her role within it. Westbrook housed 215 patients, he explained, ranging from melancholic women sent by concerned husbands to violent maniacs who required constant supervision. The staff consisted of himself as superintendent and chief physician, 3 assistant physicians, 30 orderlies, and 8 nurses, now 9 with Eleanor's arrival. The asylum operated on the cottage system, with patients divided into different buildings based on the severity and nature of their afflictions. Eleanor would be assigned to the women's acute ward, where the most recently admitted and potentially curable patients were housed. Her duties would include basic nursing care, administering medications as ordered, assisting with treatments, and maintaining detailed records of patient behavior and responses to intervention. Brennan emphasized this last point repeatedly. Accurate record-keeping was essential to his work, as he was conducting ongoing research into the efficacy of various treatment modalities. Eleanor asked what treatments she would be assisting with, and Brennan's expression shifted into something harder to read. He said he employed a variety of methods depending on the patient's specific condition: hydrotherapy, rest cure, occupational therapy, and what he called neural adjustment procedures. This last term was unfamiliar to Eleanor, and she asked for clarification. Brennan hesitated, then explained that he'd developed techniques for directly stimulating or suppressing brain function through calculated interventions, applications of electricity, precise surgical manipulation of the skull, and controlled administration of substances that affected mental state. These methods, he said, were still experimental, but showed remarkable promise in cases where traditional approaches had failed. Eleanor felt a flutter of unease in her stomach, but pushed it aside. Medical progress always required experimentation, and if Brennan's methods could genuinely cure madness, surely some discomfort to patients was justified. She told herself this firmly, as Brennan led her on a tour of the facility, showing her the women's acute ward where she would spend most of her working hours. The ward occupied the second floor of the main building, a long corridor with rooms opening on either side. Each room contained between 2 and 6 beds, with patients in various states of distress or stupor. Some lay motionless, staring at the ceiling. Others paced restlessly or sat rocking back and forth. One woman stood at the barred window, pressing her face against the glass and weeping silently. Brennan introduced Eleanor to the head nurse, a stern, middle-aged woman named Mrs. Calloway, who regarded Eleanor with barely concealed skepticism. College-educated nurses, Mrs. Calloway's expression suggested, were all theory and no practical sense. She informed Eleanor that she would work 12-hour shifts, 6 days a week, with Sunday afternoons off. Meals were taken in the staff dining room, and fraternization with orderlies was strictly forbidden. Eleanor would share a room on the 3rd floor with another young nurse named Jane. Mrs. Calloway showed Eleanor to her quarters, a small but clean room with 2 narrow beds, a shared wardrobe, and a single window overlooking the asylum grounds. Jane was off-duty and absent, so Eleanor unpacked alone, hanging her few dresses in the wardrobe and placing her books on the small shelf beside her bed. She'd brought medical texts, a Bible, and a volume of poetry that her mother had given her before dying of consumption 2 years earlier. Looking at these few possessions that represented her entire life, Eleanor felt a wave of loneliness so intense it brought tears to her eyes. She'd left behind no family, no sweetheart, no close friends, only instructors and classmates who'd wished her well, but wouldn't miss her particularly. She was utterly alone in this strange place, committed to at least a year of service under a contract she'd signed, without fully understanding what it entailed. She wiped her eyes, straightened her shoulders, and went downstairs to begin her first shift. The evening routine involved administering medications, helping patients undress and prepare for bed, and ensuring that those prone to violence or self-harm were properly restrained. Eleanor was shocked by the casual brutality of some procedures, leather straps buckled so tightly they left marks, gags forced into the mouths of women who wouldn't stop screaming, cold water thrown on patients who refused to cooperate. Mrs. Calloway explained that firmness was essential when dealing with the insane, that kindness was often mistaken for weakness, and that allowing patients too much freedom or consideration only worsened their conditions. Eleanor wanted to protest, but held her tongue. She was new, inexperienced in asylum work, and in no position to question established procedures. Perhaps Mrs. Calloway was right. Perhaps the insane did require harsh handling. The medical literature certainly suggested that moral firmness was an essential component of treatment. On her 3rd day, Eleanor witnessed her first neural adjustment procedure. A young woman named Sarah Blackwell, admitted 2 weeks earlier after attempting to drown herself in the Charles River, had been selected by Dr. Brennan as a candidate for treatment. Sarah was 26 years old, married to a lawyer, and suffering from what Brennan diagnosed as melancholia with suicidal ideation. Traditional treatments had failed. Rest, tonics, moral instruction, even a course of hydrotherapy that left her shivering and incoherent for hours afterward. Brennan believed her condition stemmed from an imbalance in her brain's electrical activity, something that could be corrected through direct intervention. The procedure took place in a special treatment room in the basement, a space Eleanor hadn't seen during her initial tour. It was equipped like a surgery, an operating table, instrument trays, bright electric lights, and a strange machine that Brennan explained generated controlled electrical current. Sarah was brought down by two orderlies, struggling and begging to be released. They strapped her to the table despite her pleas, securing her wrists, ankles, and head with leather restraints. Brennan explained the procedure to Eleanor in calm, clinical tones, as if Sarah couldn't hear every word. He would apply electrodes to specific points on Sarah's skull, then deliver carefully measured shocks designed to reset her nervous system. The treatment might cause some discomfort, but it would be brief, and the potential benefits far outweighed any temporary distress. Eleanor stood beside Mrs. Calloway and another nurse holding a cloth to wipe away saliva and making sure Sarah's airway remained clear. Brennan positioned the electrodes, metal discs connected to wires running to his machine, against Sarah's temples. He checked his settings, made some adjustments, and then activated the current. Sarah's body went rigid, her back arching against the restraints, her jaw clenching so hard that Eleanor could hear teeth grinding. The sound that came from her throat wasn't quite a scream, it was something more fundamental, a noise that seemed ripped from somewhere deeper than conscious thought. The shock lasted perhaps 5 seconds, though it felt much longer. When Brennan switched off the machine, Sarah collapsed back onto the table, unconscious or possibly something worse. Her breathing was rapid and shallow, her skin pale and clammy. Eleanor moved forward automatically, checking for a pulse, and found it racing but present. Brennan nodded with satisfaction, making notes in his record book, and instructed the orderlies to return Sarah to her room, where she would be monitored until she regained consciousness. Eleanor couldn't sleep that night. She lay in the darkness, listening to Jane breathing softly in the bed across the room, and replayed the scene in the treatment room over and over. Sarah's face contorted in agony, the inhuman sound she'd made, the way her body had convulsed against the restraints. These images refused to leave Eleanor's mind. She told herself that the treatment was scientifically sound, that Brennan was a respected physician who understood things she didn't, that medical progress often required procedures that seemed harsh to the uninitiated. But doubt gnawed at her. Sarah had been conscious and terrified before the treatment. Afterward, when she'd finally woken several hours later, she'd been different, quieter, more subdued, but also somehow absent. Her eyes had been vacant, her responses to questions delayed and confused. Was this improvement, or was it simply that the electrical shock had damaged something essential in her mind? Eleanor raised these questions tentatively with Mrs. Calloway during a break in their shift. The older nurse's response was dismissive and slightly contemptuous. Of course, the patients seemed changed immediately after treatment. That was the point. Their diseased mental processes had been interrupted, their pathological patterns disrupted. With repeated treatments, Brennan believed, healthy patterns would establish themselves. Eleanor should focus on following orders and learning her duties rather than questioning methods she wasn't qualified to evaluate. Properly chastened, Eleanor tried to push her concerns aside and concentrate on her work. Over the following weeks, she settled into the asylum's routines, the early morning rounds, the administration of medications, the feeding of patients too disturbed to feed themselves, the endless documentation of symptoms and behaviors. She got to know some of the patients, learning their histories and the circumstances that had brought them to Westbrook. Many were women whose families had found them inconvenient or embarrassing, wives who'd spoken too freely, daughters who'd refused arranged marriages, widows who'd become emotional burdens to their children. Their madness often seemed less like disease and more like reasonable responses to impossible situations, but Eleanor kept these observations to herself. She also observed more neural adjustment procedures, as Brennan worked through his patient population, treating those he believed most likely to benefit from his interventions. The methods varied, sometimes electrical stimulation, sometimes injections of substances he called neural suppressants, occasionally actual surgical procedures where he made small incisions in the scalp and manipulated the skull to relieve what he described as pressure on the brain. None of the treatments looked pleasant, and none of the patients improved in ways Eleanor could recognize as genuine recovery. They became quieter, more manageable, less likely to cause disruptions or require restraints, but they also became less present, less themselves, as if the essential spark that made them human was being systematically extinguished. One patient in particular troubled Eleanor deeply. Her name was Catherine Walsh, a 32-year-old former schoolteacher, admitted by her brother after she'd been found wandering the streets of Albany in a confused state, talking about visions and divine missions. Catherine was educated, articulate, and capable of long, lucid conversations about books, politics, and philosophy. She also had episodes where reality seemed to slip away from her, where she heard voices and saw things others couldn't perceive. Brennan diagnosed her as suffering from religious mania with hallucinatory features, a condition he believed he could cure through aggressive treatment. Over the course of 2 months, Catherine underwent 6 neural adjustment procedures. Eleanor assisted with all of them, watching as Catherine's personality gradually dissolved under the assault of electrical shocks and chemical interventions. The articulate, passionate woman who'd arrived at Westbrook transformed into someone hollow and mechanical, responding to questions with flat, emotionless phrases that sounded rehearsed rather than genuine. After the 6th treatment, Catherine stopped speaking almost entirely. She followed instructions, ate when told to eat, and sat motionless for hours staring at nothing. Brennan declared her condition greatly improved and wrote in her file that she was nearly ready for discharge. Eleanor found Catherine sitting by the window one afternoon during her rounds. She sat down beside her and tried to initiate conversation, asking how Catherine was feeling, whether she was comfortable, if she needed anything. Catherine turned slowly to look at her, and Eleanor saw something in those eyes that made her blood run cold. Not madness, but absolute emptiness, as if everything that had made Catherine a person had been burned away, leaving only a shell that breathed and moved, but contained nothing inside. Eleanor reported this to Mrs. Calloway, suggesting that perhaps Catherine needed different treatment, that maybe she was worse rather than better. Mrs. Calloway's response was sharp and final. Eleanor had been at Westbrook for less than 3 months. She knew nothing about treating mental illness. Dr. Brennan had decades of experience and published research supporting his methods. If Eleanor couldn't trust his judgment and follow his protocols without constant questioning, perhaps asylum work wasn't suitable for her. Eleanor dropped the subject, but couldn't drop her growing conviction that something was fundamentally wrong at Westbrook. She began paying more attention to details she'd previously ignored or accepted at face value. She noticed that patients selected for neural adjustment procedures were almost always those with families who visited rarely or not at all. Those whose commitment papers gave Brennan broad authority to treat as he saw fit without requiring additional consent. She noticed that Brennan's record-keeping was meticulous for treatment details, but vague about outcomes, describing patients as improved without defining what improvement meant or how it was measured. Eleanor's suspicions crystallized into certainty on a cold March evening when she discovered the locked ward. She'd been searching for extra linens in the basement, opening various storage room doors when she found one that was locked. This wasn't unusual. Medications and valuable supplies were always secured, but something about this particular door drew her attention. The lock was substantial, far heavier than necessary for a simple storage room, and there was a smell seeping from underneath, that same organic, unpleasant odor she'd noticed on her first day, but stronger and more concentrated. She tried the door handle anyway, more from curiosity than expectation, and was surprised when it turned. Someone had left it unlocked, probably by accident. Eleanor pushed the door open and immediately wished she hadn't. The room beyond wasn't a storage closet, but a corridor leading deeper into the basement, lit by widely spaced gas lamps that created more shadows than illumination. Along both sides of the corridor were cells, Not rooms, but actual cells with heavy doors containing small barred windows. Eleanor stood frozen in the doorway, her rational mind struggling to process what she was seeing. This was a ward she hadn't known existed, a place that wasn't mentioned in any of the institutional documentation she'd read or discussed during staff meetings. She knew she should turn around, close the door, and pretend she'd never seen this place. Instead, she walked forward, drawn by a compulsion she couldn't name. The first cell contained a woman curled in the corner on a thin mattress, her hair matted and her dress filthy. She didn't react to Eleanor's presence, didn't even seem aware of it. The second cell held another woman in similar condition. The third, fourth, and fifth cells were the same, women in various states of neglect, some conscious and staring, others unconscious, or possibly dead. Eleanor couldn't tell from looking through the barred windows. She counted 12 cells total, 9 of them occupied. These weren't patients receiving treatment. They were prisoners being warehoused in conditions that violated every standard of medical care Eleanor had been taught. She recognized several faces, women who'd undergone neural adjustment procedures weeks earlier and had then simply disappeared. Eleanor had assumed they'd been discharged or transferred to other facilities. Instead, they were here, locked in the basement, forgotten or deliberately hidden. Eleanor heard footsteps behind her and spun around. Brennan stood at the corridor entrance, his expression unreadable in the dim light. He said her name once, flatly, as a statement rather than a question. Eleanor stammered something about looking for linens and finding the door unlocked by accident. Brennan nodded slowly, his eyes never leaving her face. He said they should talk in his office immediately, and gestured for her to precede him back upstairs. Eleanor's heart hammered as she walked through the corridors, acutely aware of Brennan behind her, uncertain whether she was in danger or simply in trouble for violating some institutional policy she hadn't known existed. In his office, Brennan closed the door and indicated she should sit. He sat behind his desk, steepled his fingers, and studied her for a long moment before speaking. He told her that what she'd seen was the asylum's experimental ward, a space used for the most intensive and advanced neural adjustment procedures. The patients housed there were the most severely afflicted, those for whom standard treatments had completely failed and who required extraordinary intervention. The conditions might appear harsh, but they were necessary for the treatment protocol. Patients in the experimental ward were kept in isolation to prevent sensory stimulation that might interfere with the neural restructuring process. Eleanor found her voice and asked why she and the other nurses hadn't been informed about this ward, why these patients weren't included in the regular staff rotations and documentation. Brennan's expression hardened. The experimental ward, he explained, was his private research project, funded by a separate grant and operating under different institutional guidelines. The patients had all been legally committed with full family consent for experimental treatment. Their care was his responsibility alone, and he preferred to maintain strict control over who had access and information. Very few staff members knew about the ward's existence, and those who did had been specifically selected and instructed in its protocols. Eleanor was not among that selected group, which meant she'd seen things she wasn't authorized to see. Brennan leaned forward, his intense blue eyes locked on hers, and asked what she intended to do with this information. Eleanor's mouth went dry. She understood the implicit threat in the question. If she reported what she'd seen to authorities outside the asylum, who would they believe? A young nurse with 3 months' experience, or a renowned physician with years of published research and institutional authority? Moreover, what exactly would she report? That patients were being housed in basement cells. Brennan would simply explain it as a necessary isolation ward for violent patients, that they looked neglected and possibly dying. He would claim they were receiving intensive treatment that required minimal external stimulation. Eleanor had no proof of wrongdoing, only her own sense that something was terribly wrong. She chose her words carefully, telling Brennan that she wasn't planning to report anything, that she understood she'd seen something confidential by accident, and that she would keep the information to herself. Brennan studied her face, clearly assessing whether she was truthful. Finally, he nodded and said he was glad they understood each other. However, given what she'd seen, he thought it best to include her in the experimental ward protocols. Starting the next day, she would assist him with treatments in the locked ward, working directly under his supervision. This way, he explained, she would understand the scientific basis for what she'd witnessed and wouldn't be troubled by incomplete information. Eleanor's first day working in the experimental ward began at 6 in the morning. Brennan met her at the locked door, now properly secured with the heavy padlock Eleanor had initially found unfastened. He unlocked it and led her down the dim corridor, explaining protocols as they walked. The patients in these cells were at critical stages of neural restructuring, he said. They required minimal stimulation, which meant no unnecessary conversation, no attempts to comfort or engage them emotionally. Eleanor's role was purely mechanical, to assist with treatments, administer medications, and maintain basic hygiene when absolutely necessary. The patient's apparent distress or confusion was part of the healing process, he insisted. Their brains were reorganizing themselves at a fundamental level, and what looked like deterioration was actually transformation. Eleanor wanted to believe him. She wanted to trust that his education and experience qualified him to make judgments that seemed horrifying to her untrained eyes. But as she followed him from cell to cell, observing the condition of the women imprisoned there, belief became increasingly difficult to maintain. The first patient Brennan treated that morning was a woman named Martha Hendricks, 41 years old, admitted 6 months earlier with a diagnosis of chronic hysteria. Martha had undergone 12 neural adjustment procedures, and according to Brennan's records, she was responding exceptionally well. Eleanor looked through the cell window at Martha and saw a skeletal figure lying motionless on a stained mattress, her eyes open but unseeing, her breathing shallow. Brennan unlocked the cell, entered with his medical bag, and gestured for Eleanor to follow. The smell was overwhelming, urine, feces, and something else that Eleanor recognized from her training as the sweet, sickly odor of infection. Martha didn't react as Brennan approached and knelt beside her. He checked her pulse, lifted her eyelids to examine her pupils, and made notes in his record book. Then he withdrew a syringe from his bag, filled it from a small brown bottle, and injected the contents directly into Martha's neck. Eleanor asked what he'd administered, keeping her voice neutral and professional. Brennan explained it was a compound of his own formulation, a combination of morphine, atropine, and several other substances, including extract from the pituitary glands of sheep. The mixture, he claimed, facilitated neural plasticity while suppressing the brain's resistance to restructuring. Clinical trials had shown remarkable results, though he admitted the treatment was still in experimental stages. Eleanor watched Martha for any sign of response to the injection. There was none. Martha continued staring at nothing, breathing her shallow breaths, utterly disconnected from her own body and the world around her. Brennan declared the treatment successfully administered and moved to the next cell. The pattern repeated throughout the morning. Each patient received injections, sometimes in the neck, sometimes in the spine, occasionally directly through small holes Brennan had drilled in their skulls weeks earlier. He explained this last method allowed him to deliver medication directly to the brain tissue, bypassing the complications of systemic absorption. Some patients moaned when the needles penetrated their flesh. Others didn't react at all. None could speak coherently or respond to simple commands. By midday, Eleanor's hands were shaking so badly she could barely hold the instruments Brennan requested. She excused herself, claiming she felt ill, and fled to the nearest washroom where she vomited repeatedly. When she emerged, Brennan was waiting in the corridor. His expression was sympathetic but firm. He told her that he understood her reaction. Many people experience distress when first confronting the realities of advanced psychiatric treatment. The patients looked terrible, he acknowledged, but their external condition was irrelevant compared to the neural reformation occurring inside their skulls. Some of these women would recover completely, he assured her, emerging from their current states with their madness cured and their minds restored to health. Others might not survive the treatment, but they'd been hopeless cases regardless, doomed to spend their lives in restraints and isolation. At least his methods offered them a chance, which was more than traditional asylum care provided. Eleanor asked directly what Brennan expected the survival rate to be. His hesitation before answering told her more than his eventual words. Perhaps 50%, he said, maybe 60% if he refined his protocols further. Some patients' systems simply couldn't handle the stress of neural restructuring. Their brains were too damaged, their bodies too weak. But the ones who did survive would be cured, and wasn't that worth the risk? Eleanor thought about Martha Hendricks lying in her own waste, her mind so thoroughly destroyed that she couldn't even blink in response to light. She thought about the other women in the cells, all in various stages of what Brennan called treatment, but which looked indistinguishable from systematic destruction. She asked what would happen to the patients who didn't survive. Brennan's answer was matter of fact. They would be buried in the asylum cemetery, their deaths attributed to the mental illnesses that had brought them to Westbrook in the first place. Their families would be notified, condolences offered, and that would be the end of it. No one questioned death certificates signed by asylum superintendents. The mentally ill died all the time in institutions, and no one investigated too closely. Eleanor continued working in the experimental ward for 3 weeks, assisting Brennan with treatments that grew progressively more extreme. He began using higher voltages in his electrical stimulation, increasing the duration of shocks until patients convulsed so violently that several broke bones despite the restraints. He experimented with new chemical compounds, injecting substances that caused seizures, paralysis, or states of unconsciousness lasting days. He performed surgical procedures without anesthesia, drilling into skulls and inserting probes to stimulate or destroy specific brain regions. Through all of this, Eleanor maintained detailed records as instructed, documenting procedures, dosages, and patient responses in the meticulous handwriting she'd been taught in nursing school. She assisted with restraining patients who fought against treatment, held basins to catch vomit and blood, cleaned wounds, and disposed of soiled linens. She did everything required of her while a part of her mind observed from a distance, horrified and helpless. During her off hours, Eleanor searched for information about Brennan's methods in the medical texts available in the asylum's small library. She found mentions of electrical treatment for melancholia, references to surgical intervention for severe mania, discussions of various chemical therapies, but nothing she read matched the scale or intensity of what Brennan was doing. His treatments weren't refinements of accepted practices, they were something else entirely. Experiments conducted without oversight or ethical guidelines. She considered writing to medical authorities, to the state board that oversaw asylum operations, but immediately saw the futility. What would she say? That a respected physician was treating patients aggressively, that some patients were dying. She had no proof of wrongdoing that would convince officials accustomed to deferring to medical expertise. Moreover, Brennan had been careful. His records described treatments in technical language that sounded scientific and justified. He documented informed consent from families, though Eleanor had seen those forms and knew they contained vague language about experimental procedures without specific details. He maintained that his work was advancing psychiatric science, and who could definitively prove otherwise. 3 patients died during Eleanor's 3rd week in the experimental ward. The first was Martha Hendricks, who simply stopped breathing one morning after her daily injection. Brennan recorded the death as resulting from complications of chronic hysteria. The second was a young woman named Alice Porter, who'd been admitted for treatment of nervous exhaustion. After a particularly intense electrical treatment, Alice developed a fever that climbed steadily for 48 hours until she died in convulsions. Brennan attributed her death to brain fever, a common complication of mental illness. The third was Catherine Walsh, the former schoolteacher whose personality had been gradually erased over months of treatment. Catherine had stopped eating several days earlier, refusing food even when it was forced into her mouth. She died of starvation and dehydration, while Eleanor watched helplessly, knowing that intervention would only prolong suffering without offering hope of recovery. After Catherine's death, Eleanor made a decision. She couldn't stop Brennan directly, couldn't report him through official channels, but she could document what was happening in a way that might eventually lead to accountability. She began keeping a second set of records, separate from the official files, describing treatments honestly and completely. She noted the patient's actual conditions rather than Brennan's optimistic interpretations. She recorded deaths with their real causes, not brain fever or complications of existing conditions, but direct results of the treatments administered. She smuggled these records out of the asylum during her Sunday afternoon leave, storing them in a trunk at the boarding house where she'd lived before coming to Westbrook. Her plan was vague: accumulate evidence, find someone trustworthy to review it, perhaps a physician or journalist who might investigate independently. It wasn't much of a plan, but it was something. Meanwhile, Brennan seemed to notice nothing amiss. He praised Eleanor's work, commented on how well she'd adapted to the demands of experimental treatment, and began discussing his plans for expanding the program. With sufficient funding, he believed he could develop a comprehensive cure for all forms of mental illness. The locked ward would become a center for psychiatric research, attracting physicians from around the world. Eleanor would be part of medical history, he told her, a pioneer in the treatment of humanity's most devastating afflictions. Eleanor smiled and nodded and continued documenting atrocities. Then Jane noticed something wrong. Eleanor's roommate had been largely absent from their shared quarters, working different shifts and spending her limited free time with family in town. But one evening she returned to find Eleanor sitting on her bed, writing in a journal with an expression of intense concentration. Jane asked casually what Eleanor was working on, and Eleanor replied without thinking that she was making notes about the experimental ward. Jane's face went blank. She asked carefully what experimental ward Eleanor meant. Too late, Eleanor realized her mistake. Jane wasn't supposed to know about the locked ward. She was one of the majority of staff who remained ignorant of its existence. Eleanor stammered something about misunderstanding ward designations, but Jane wasn't fooled. The younger woman sat down slowly, her eyes wide, and asked Eleanor to tell her everything. Eleanor hesitated, then made another decision. She told Jane about the locked corridor, the cells, the patients in various stages of destruction. She described Brennan's treatments in detail, sparing nothing. Watching Jane's expression shift from disbelief to horror. When Eleanor finished, Jane was crying silently. She whispered that she'd wondered where certain patients had gone, had asked questions and been told they'd been discharged or transferred. She'd had no idea they were locked in the basement, being systematically destroyed. Jane wanted to go to the authorities immediately, to report everything to the sheriff or the state medical board, or anyone who would listen. Eleanor explained why that wouldn't work, why they needed more evidence, why rushing forward without preparation would only alert Brennan and allow him to destroy records and manufacture explanations. Jane reluctantly agreed to wait, to help Eleanor gather documentation, to be patient and strategic rather than impulsive. For 2 weeks, the two women worked in secret coordination. Jane began paying attention to which patients disappeared from the regular wards, noting names and dates. Eleanor continued her detailed record-keeping, now including Jane's observations. Together, they created a comprehensive timeline showing how many women had entered the experimental ward and how few had emerged alive. The evidence was damning, but Eleanor still didn't know what to do with it. Then fate intervened in the form of a visitor. A journalist named Robert Chambers arrived at Westbrook in early May, researching a series of articles about asylum conditions across New York State. He'd been inspired by recent exposés of similar institutions and believed the public deserved to know how tax money was being spent on mental health care. Brennan gave him a carefully orchestrated tour of the regular wards, showing him clean rooms, calm patients, and orderlies who spoke respectfully to their charges. Chambers seemed satisfied, took notes, and thanked Brennan for his cooperation. Eleanor intercepted him as he was leaving, pulling him aside in a corridor where they wouldn't be overheard. She told him there were things he should see that weren't on the official tour, things that would matter to his readers. Chambers studied her face, assessing her credibility, and agreed to meet her in town the following Sunday. Eleanor spent the next week preparing. She organized her secret records chronologically, attached Jane's observations, and wrote a detailed summary explaining Brennan's methods and their outcomes. She included patient names, treatment descriptions, and death dates. She anticipated questions Chambers might ask and prepared answers supported by documentation. On Sunday afternoon, she met him at a small cafe far enough from the asylum that no one would recognize her. Chambers listened to her story with increasing intensity, interrupting occasionally to ask clarifying questions, taking notes in a battered journal. When Eleanor finished and handed him the documents she'd compiled, he spent 20 minutes reading through them, his expression darkening with each page. Finally, he looked up and asked why she was doing this, why she was risking her position and possibly her safety to expose Brennan. Eleanor answered simply that she'd watched women die for no reason except one man's ambition disguised as science. She'd stood by and assisted because she'd been afraid and uncertain, but she couldn't do it anymore. Even if it cost her everything, she needed someone to know what was happening behind Westbrook's locked doors. Chambers promised to investigate thoroughly, to verify her claims independently, before publishing anything that might ruin reputations or careers. He asked if she was prepared for consequences. Brennan would know who'd betrayed him, would likely destroy Eleanor's nursing career, might even pursue legal action for theft of confidential records. Eleanor said she understood and accepted the risks. Chambers left with her documentation, promising to contact her within 2 weeks. Eleanor returned to Westbrook and her duties, moving through her routines mechanically while waiting for something to break. The break came sooner than expected. 3 days after her meeting with Chambers, Brennan summoned Eleanor to his office. She entered to find him sitting behind his desk with her secret journal open before him. Not the documents she'd given Chambers, but her original notes, the ones she thought she'd hidden safely in her room. Jane sat in the corner, her face tear-stained and bruised. Eleanor's stomach dropped as she realized what had happened. Brennan's voice was cold as winter as he explained that Mrs. Calloway had noticed Eleanor and Jane whispering together frequently, had become suspicious, and had searched their room during their shift. She'd found Eleanor's journal and brought it directly to Brennan. Jane had been questioned. Brennan didn't specify what methods had been used, but Jane's appearance suggested they hadn't been gentle and had confessed to the collaboration. Now Brennan wanted to know what else Eleanor had done, who else she'd told, whether copies of these notes existed elsewhere. Eleanor considered lying but saw no point. Brennan already knew the core truth. She told him about Robert Chambers, about the documents she'd provided, about the investigation that was likely already underway. Brennan listened without expression, then nodded slowly as if confirming something he'd already suspected. He stood, walked to the window, and spoke without turning around. Eleanor had committed theft of confidential medical records, violation of patient privacy, and breach of institutional trust. She'd endangered ongoing medical research and potentially ruined the careers of everyone associated with Westbrook. He could have her arrested, could press charges that would send her to prison for years. However, he was willing to be merciful if she cooperated. She would write a letter to Chambers retracting everything she'd said, admitting that she'd misunderstood treatments she wasn't qualified to evaluate, confessing that her accusations had been motivated by personal animosity toward Brennan for reasons unrelated to his medical practices. She would sign a legal statement swearing to the truth of these retractions. In return, Brennan would allow her to resign quietly and leave Westbrook without criminal charges. Eleanor refused immediately and absolutely. She told Brennan that she'd rather go to prison than help him continue torturing women under the guise of treatment. She'd told the truth to Chambers, and she wouldn't recant no matter what threats Brennan made or what consequences she faced. Brennan turned from the window, his face flushed with anger barely contained. He informed Eleanor that she'd given him no choice. He would have her committed to Westbrook as a patient, diagnosed with hysteria and delusional disorder. Her accusations against him would be reframed as symptoms of her mental illness. She would be housed in the experimental ward, and he would personally oversee her treatment until she recovered her reason and agreed to sign the retractions he required. Eleanor felt ice spread through her veins as she understood that he was completely serious. Jane sobbed in the corner, and Eleanor realized that Brennan had probably made her the same offer: recant or be committed. Jane had apparently refused as well, which meant both of them would become inmates of the institution where they'd worked as nurses. Brennan called for orderlies, and 2 large men entered the office. He instructed them to escort Eleanor and Jane to the locked ward and place them in separate cells. The women would be held there pending medical evaluation and formal commitment proceedings. Eleanor tried to resist, but the orderlies were experienced in subduing difficult patients. Within minutes, she was being half carried, half dragged down the corridor toward the basement. She was locked in a cell 3 doors from where Catherine Walsh had died, in a space barely 6 feet square with a narrow cot, a chamber pot, and nothing else. The door closed with a sound like the end of the world. Eleanor sat on the cot, and forced herself to think rationally despite the panic clawing at her chest. Chambers had her documentation. Even if she recanted, the evidence existed. Even if Brennan silenced her permanently, someone knew what was happening at Westbrook. She held on to this thought like a lifeline and waited to see what would happen next. What happened was nothing, at least initially. Eleanor remained in the cell for 3 days without seeing anyone except an orderly, who pushed food through a slot in the door twice daily. The isolation was disorienting, the silence broken only by occasional sounds from other cells, moaning, crying, the shuffling of feet on stone floors. Eleanor tried to maintain some sense of time and routine, exercising in the tiny space, eating the inadequate food, sleeping when exhaustion overcame anxiety. On the 4th day, Brennan appeared. He unlocked her cell and entered, carrying his medical bag. He informed Eleanor that he was beginning her treatment for delusional disorder. The initial course would involve heavy sedation combined with isolation therapy to break down her resistance to reason. If this proved insufficient, he would move to more aggressive interventions: electrical stimulation, chemical treatments, possibly surgical intervention if her condition proved particularly intractable. Eleanor told him he was insane, that he couldn't possibly believe anyone would accept his diagnosis of a woman who'd been working competently as a nurse days earlier. Brennan smiled and explained that Eleanor's breakdown had been building for weeks. Multiple staff members had noticed her becoming increasingly erratic and paranoid, making wild accusations against him, speaking obsessively about imagined abuses. Mrs. Calloway would testify to this. The orderlies would corroborate it. Jane had already signed a statement confirming Eleanor's disturbed behavior, though Brennan admitted regretfully that Jane herself had also required commitment after demonstrating similar symptoms. It was tragic how mental illness could spread through close association, particularly among susceptible young women. Eleanor realized with sick certainty that Brennan had constructed a complete narrative that would be impossible to disprove. Who would believe her word against multiple staff testimonies and Brennan's medical authority? But Brennan had miscalculated in one crucial way. While Eleanor was locked in the basement being threatened with experimental treatments, Robert Chambers was conducting his investigation. He'd interviewed families of women who'd been patients at Westbrook, asking about their relatives' conditions upon admission and the circumstances of their deaths or discharges. He'd spoken with former employees who'd left the asylum under mysterious circumstances. He'd reviewed death certificates and found disturbing patterns: an unusually high mortality rate, causes of death that seemed vague or inconsistent, burial records showing dozens of bodies interred in unmarked graves. He'd also contacted medical experts at Columbia University, showing them Eleanor's documentation and asking for professional evaluation of the treatments described. The experts were unequivocal. Nothing Brennan was doing had any legitimate scientific basis. His neural adjustment procedures were torture, not therapy. His experimental compounds were dangerous combinations of addictive substances with no proven therapeutic value. His surgical interventions caused brain damage rather than curing illness. Chambers worked quickly, knowing that Eleanor might be in danger. 6 days after their meeting, his first article appeared in the New York Tribune under the headline, "Horror in the Asylum: Patients Tortured Under Guise of Treatment." It described Westbrook in devastating detail, naming Brennan specifically and quoting extensively from Eleanor's documentation. The response was immediate and explosive. Other newspapers picked up the story. The State Medical Board launched an investigation. The Attorney General announced that his office would review all deaths at Westbrook over the past 2 years. Reformers who'd been fighting for asylum oversight seized on the scandal as proof that stronger regulations were desperately needed. Within 24 hours of the article's publication, state investigators descended on Westbrook, demanding access to all facilities and records. Brennan tried to deny them entry to the locked ward, claiming patient privacy concerns, but the investigators had legal authority and police backing. They forced the doors open and found what Eleanor had documented: 9 women in various states of neglect and medical abuse, including Eleanor herself and Jane. The investigators immediately ordered all patients in the experimental ward moved to the regular hospital in town for emergency medical care. They arrested Brennan on charges of assault, reckless endangerment, and practicing medicine in a manner dangerous to public health. They seized all his records, medical equipment, and research notes as evidence. Eleanor and Jane were treated for malnutrition and dehydration, but were otherwise physically unharmed, having been imprisoned for less than a week. The other women in the locked ward were not so fortunate. 2 died within days of being moved, their bodies too damaged to recover. The surviving 7 required months of medical care, and none ever fully recovered their mental faculties. The trial of Dr. Nathaniel Brennan became a sensation, covered by newspapers across the country. Prosecutors presented Eleanor's documentation, expert testimony about the treatment's lack of scientific basis, and testimony from surviving patients and their families. Brennan's defense argued that he'd been engaged in legitimate medical research, that all his patients had been legally committed with family consent for experimental treatment, and that their deaths were unfortunate but not criminal. The jury deliberated for 3 hours before convicting him on all counts. He was sentenced to 15 years in prison and stripped of his medical license. Westbrook Asylum was shut down permanently, its remaining patients transferred to other institutions. Eleanor testified at the trial, describing everything she'd witnessed during her time at Westbrook. Her testimony was considered crucial to the prosecution's case, and she was publicly praised for her courage in exposing Brennan's abuses. But the experience left her deeply shaken. She completed her testimony and then left New York, moving to Chicago, where she found work at a hospital with no psychiatric ward. She never worked with mental patients again, couldn't bring herself to enter an asylum even as a visitor. She'd seen what could happen when medical authority went unchecked, when ambition disguised itself as science, when vulnerable people were treated as experimental subjects rather than human beings deserving of dignity and care. The Brennan case led to significant reforms in asylum oversight, mandatory inspections, external review of experimental treatments, requirements for detailed informed consent. These reforms came too late for the women who died in Westbrook's locked ward, but they perhaps prevented similar abuses elsewhere. Eleanor lived until 1953, dying at 75 in relative obscurity. Her obituary mentioned that she'd been a nurse but said nothing about Westbrook or Brennan or the role she'd played in exposing one of the most horrific episodes in American psychiatric history. That story was largely forgotten, buried in old newspaper archives and court records that few people bothered to examine. But it remained true. In 1901, a doctor tried to cure madness using prohibited methods, and the real madness was believing that torture could ever be therapeutic. Every family hides secrets, some so dark they should never see the light of day. Here, we open the doors to those shadowed pasts, uncovering hidden crimes, silent pacts, and stories that echo like ghosts through the halls of memory. If you've made it this far, it means you also carry that forbidden curiosity. So don't hesitate. Subscribe to the channel now, turn on the bell, and follow our next revelations. Because every day, new secrets emerge, and only those who dare to face the truth remain to hear them.